Thank you, Alistair. Yeah, I mean, I'm very honoured to have followed for some esteemed colleagues this evening, and there's some following me on. You'll have to excuse my pragmatism. So I'm a nurse. I've worked overseas with the military many times. I've specialised in command and control of aeromedical evacuation, but also in the building of medical treatment facilities. I was out in Sierra Leone. And so I also work in innovation all day, every day, and we're working on a number of projects that have been repurposed to the COVID crisis. Now, I'm not a cancer expert, but I have spoken to a number of colleagues who are working in this area. I had a really great chat with some friends who are working in the Queen Elizabeth. And what I'm going to talk about for the next 3.5 minutes is just some guiding principles to help those who are trying to restart cancer services. And it's just advice based on my experience, my colleagues. And so, you know, what is the heart of it all? Communication, really, as always, and the military will always tell you that, but comms is the key part to all success. And my flow diagram I've got written here starts with comms at the top. And then really, if you're trying to start a service, doesn't really matter which one, what you're trying to do. Site selection is so important. For us, we're quite lucky. We get to build our facilities where we want them. You guys probably haven't got that capability. We've talked about selection of entire hospitals become cold or COVID light or COVID free facilities. That's optimum. If you can't do that, then splitting your hospital down can be a real a problem, and one to address through, again, communication and then preparation. I'm going to use a load of words that end in shun. Sorry, it's kind of a habit. So you communicate to your staff what you want to do, you communicate to your patients what's coming, and then you prep your hospital and you prep your staff or your facility or clinic or whatever it is, and you discuss with them what the mission is in order to get patients through your facility in a safe way. It is a real problem if you're in a facility that mixes both cold and hot patients, but it can be done. There's loads of innovations there, and they're really quite simple, fortunately. It's great. Signage, arrows, tape, barriers, security guards, locking lifts, one-way passages, all that kind of stuff. But the site selection is key for that. You need to choose a section of your hospital or your trust that can be partitioned away. Then you need standardization. This is a very military thing, I'm really sorry, but you need the same kit, you need the same PPE, you need the same training. The procedures need to be really similar in order to work. Barriers need to be the same, colors need to be the same, signage, all of that. This optimizes both your staff and your patients to understand what's going on. Then you delegate the task. You give it to the units that need to undertake this. It could be your theatre department or your endoscopy unit. We've talked about those before. Get them to understand the problem and then design a system that allows cold and hot or either to enter your system appropriately. And then you optimize it through comms. You debrief every day, you feedback every day, you look at every significant event, and then you adjust the system around that. And further optimization, it's weird for me, so only a fifth of my chat is about innovation, really. Once you have a really nice, tight system where your standard operating procedures are fed in through your staff on the ground and just overseen by the centre, then you can start looking at digitization, use of telemed, reduce the capacity coming in through the door, through the systems that we've already talked about. So digital patient access, doing consultations online or via people's phones if possible. Tracking, triage systems, decision assistance systems. I mean, Professor Ertz just talked about her triage system that they've come up with. I'm hoping that that's been spread around. These things can reduce capacity, reduce footfall, and help you build these pathways for only those who require them. Test and adjust all of this stuff. Make sure it works, and then adjust appropriately.